All right, this is an antiarrhythmics question. A 45-year-old man on treatment for atrial fibrillation undergoes exercise ECG testing. At rest, his QRS duration is 95 milliseconds and his QT interval is 410 milliseconds. At peak exercise, the QRS increases to 125 milliseconds. What was it before? 95. Now it's improved to 125. It's widened. The QRS complex is widened. While the QT remains unchanged, but around 405 milliseconds. Which medication is he most likely taking? Atenolol, digoxin, dofetilide, Flecainide, or verapamil. Okay, so there's a couple of different medications here, and what we notice is we look at the QRS and we look at the QT interval. So at peak exercise, the QRS is increasing from 95 to 125, and the QT is remaining unchanged. It's around 405 later on. So that means we're ruling out any QT prolongation drugs. So we're ruling out any drugs that actually affect repolarization and affect the potassium efflux phase of the cardiac action potential. So what was the answer? So we're ruling out something like dofetilide. So we have the mnemonic amiodarone, ibutylide, dofetilide, and sotalol, AIDS, for all of our potassium blocking antiarrhythmics. These are all of our antiarrhythmics that block potassium. So what we do have, however, is flecainide. So flecainide has a fat QRS. So remember all the F's, right? Flecainide is used for a fast heart. Fat QRS, it widens the QRS, meaning it affects specifically the sodium phase, blocks the sodium channel, so it prolongs that QRS. Faster heart rate. With flecainide, what's happening? It's a faster heart rate. More sodium channels are blocked, which widens the QRS, right? What is the golden difference? So the golden difference is basically flecainide is a class 1C antiarrhythmic. It is going to block the sodium channels to cause a sodium channel blockade, and that is going to prolong phase 0. So it's the phase 0 of the action potential. And what we notice is that it widens the QRS. So that's what was in our question as well. And the other thing is it can be worse at higher rates. So I do have a mnemonic at this, but essentially it has use dependence. The widened QRS is worse for tachycardic patients, for patients who have a higher heart rate. Dofetilide is the opposite. Dofetilide does the opposite. So dofetilide does the opposite, meaning it's worse at lower heart rates, right? So someone who's bradycardic with a heart rate of 53, dofetilide would then prolong the QT interval. Dofetilide also works at class 3 antiarrhythmics. So now it's affecting the potassium phase with causing marked prolonged repolarization. Okay, so what was the hack for this question? Flecainide works at a fast heart rate. It prolongs the QRS. It causes a fat QRS. Faster heart rate, more sodium channel blockade, widens the QRS. Dofetilide does the opposite. So it's like it's more impacted when you have bradycardic patients, right? Bradycardic patients, low heart rate. Anyway, what else? Delayed repolarization, QT is prolonged. Think torsades.